The geriatric surgery program was designed to help you achieve your best surgical outcomes. Your surgical team will create a plan of care to meet your needs during all phases of the surgical process. Before your procedure, you will have an appointment with a member of your surgical team to prepare you for your upcoming surgery. During this visit, your provider will explain to you the anticipated impact of your surgical procedure on your overall function and day-to-day life. They will also ask you about your treatment goals. It's important to start thinking about treatment goals before you meet with your surgeon. Treatment goals are the outcomes that are the most important to you after surgery. For example, one of your treatment goals may be to continue going on your daily walk with friends or to bake your favorite recipes for your family. Your surgeon will consider your goals while making treatment plans with you. Your provider will also review any advance directives that you have on file. Advance directives are legal documents which outline healthcare decisions you would like to happen in the event that you were unable to make such decisions for yourself. One example is a healthcare proxy. A healthcare proxy is a document in which you select a person, such as a family member, to make healthcare decisions for you if you can no longer make them yourself. If you do not have any advance directives in place, your provider will give you and your family information on the different types of advance directives. Make sure to have these documents completed before surgery. Before your procedure, you will also be screened for risk factors that can lead to complications during or after surgery. These are called geriatric vulnerability screens and include assessments for impaired cognition, delirium risk, impaired functional status, impaired mobility, malnutrition, and difficulty swallowing. If you screen positive for any of these risks or are age 85 and older, your surgical team will take additional precautions to improve your care. Your provider will also review your current medications before surgery. They may reduce or remove medications that are high risk in older adults and offer other medications if needed. They will also recommend anesthesia techniques that decrease the risk of post-surgery delirium. If you require pain medication after surgery, you will be prescribed medication that is appropriate for older adults. Your surgeon and anesthesiologist will be in the operating room with the surgical room staff. Operating rooms are usually kept cool, but you will be provided with a warm blanket. There will be a process in place to ensure that your eyeglasses and hearing aids will be kept with you in your surgical suite and returned to you quickly after surgery. Your body will be positioned on the operating table in a way that prevents skin breakdown, which is more common among older adults during surgery. They will also make sure you are positioned with your joints in alignment, which can help avoid functional impairments after surgery. After your surgery, you will be moved to the post-recovery room, and you will stay there until you are fully alert. Your surgical team will take steps to limit your risks for complications. Older patients lose mobility quickly when on bed rest. To prevent this, your surgical team will screen you for any mobility limitations and develop a plan that addresses your needs, promotes function, and ensures early, frequent, and safe mobility. After surgery, you are at increased risk for delirium, a sudden change in brain function. Delirium is a major setback for older adults undergoing surgery. To prevent delirium, your surgical team will screen you for delirium every 12 hours and make sure you are properly hydrated, know where you are and what time it is, and have all of your adaptive equipment, including eyeglasses and hearing aids. When it's time to be discharged to your home or rehab facility, you will be assessed for any changes in your health that may have happened during or after your surgery. This assessment will include screening for impaired cognition, delirium risk, impaired functional status, impaired mobility, and malnutrition. If there were any changes to your health status, your surgical team will create an action plan to address these issues. Your action plan will be added to your medical records and discharge documents. Your medication needs may change after surgery. Before discharge, the surgical team may prescribe you new medications or have you stop medications you are currently taking. Your care team will provide you a list of your current medications. They will also ensure that you and your caregivers understand what medications you are taking, how you are taking them, and how to monitor the effects of the medication. Your care team will share your updated medication lists with your primary care provider. This will keep your primary care provider informed and ensure that you will continue on the right medications after discharge. At discharge, a member of your care team will educate you, your family, and caregivers on health conditions that are common among older adults after surgery, as well as how to respond to any changes in your health status after discharge. This education will include steps that you can take to lower your risk for delirium and information on community supports that are available for you and your family if you have dementia or depression. You may also receive referrals to other providers, for example, a physical or occupational therapist to improve your mobility. Finally, before going home or to a rehab facility, you will receive a discharge summary. Your provider will discuss this summary with you and also give a copy to you and your family. Your discharge summary will also be sent to your primary care provider. If you are being discharged to rehab care, your discharge summary will be provided to the healthcare team at the facility. Remember, your surgical team will create and implement a plan of care to meet your needs during all phases of the surgical process. And the geriatric surgery program ensures that all members of your surgical team are working together to help you achieve your best surgical outcomes.